Hello and welcome to the final session for Nurse Midwifery Week 2017. My name is Jane Houston and I'm the Clinical Director of Midwifery and Women's Health at Frontier Nursing University. And it really has been a pleasure for me this week to listen to such a diverse group of presenters, speakers and presentations. It's really spoken really clearly to our mission focus as answering the call in 2017. So our call this particular year in 2017 is, how can I make a difference as a nurse midwife in my community? How can I make a difference? So we really want to look at the key issues from the week, and this is a summary presentation of all our wonderful presentations, which are all available for your listening pleasure. They are available on YouTube and the links will be freely supplied from Frontier, so you'll be able to listen again to all the wonderful presentations. But we really want to look at, are we answering the call of Mary Breckenridge? Our leader and president, Dr. Sue Stone, really kicked off our week in a really positive manner, looking at workforce and leadership issues in the US, and it was a really strong start to the week. She really encapsulated the shortage of providers for obstetrical and midwifery care in the United States, and that we are having increasing birth rates. Unfortunately, we're also having increasing problems. Maternal mortality rates are increasing in the United States. We don't currently have, unlike the other 59 developed countries that we compare ourselves to, we do not have universal provision of coverage for healthcare. There is a dire need now for more midwives and nurse practitioners to improve outcomes across the board. This is not just in obstetric care, but across the board for all areas of healthcare. We need to improve primary care, because that's really where it starts. When you have a healthy population, you're able to provide better care. So looking at primary care as a solution, and we really need to have more diverse providers. We need servant leaders, leaders that are engaged in their communities. We need leaders in midwifery to create positive solutions. So it really was a fantastic way to start our virtual conference this week. Taking it on from there, Dr. Anne Corcoran discussed really in detail the history of the Frontier Nursing Service and delved into looking at how Mary Breckenridge became the really innovative leader of her time, with her experiences in France and the UK during and after the war, the reconstruction of France. It really taught her a lot about logistics. How do we create workforces that work in different communities? So she developed a program based on the volunteers she'd seen in France, and these volunteers now, and it continues in our great history at Frontier with the couriers. And these couriers were able to work with the nursing staffs to provide excellent care across the board. Dr. Corcoran also discussed the importance of nursing outreach. The nurse in the community was known in the area of Haydn. She did outreach in the whole area. Each nurse was able to really reach into the neighbourhood and make a difference. Then she went on to discuss the development of Frontier Nursing University, with faculty beginning to teach the science of midwifery in a decentralised manner in rural communities. And that's really been the success of Frontier as we know it today, that we're able to provide excellent midwifery scientific teaching with great faculty across these United States. So we've really looked into that and really moved on the vision of Mary Breckenridge from perhaps, let's say, humble beginnings in France and London when she went to her midwifery training, and then being able to bring a really committed workforce that worked for those needs at that time. And then a little different tone was set by Dr. Tonya Nicholson. She had a very lively student midwife Q&A. It's very important, we know, to engage students early. We want them to be engaged engaged, so they'll be becoming the leaders of the future. We know that the average nurse midwife in the United States is well over 50 years of age, and that being around my age, we know that we really need a younger, really vibrant workforce in midwifery. It's a very full-on job, so we really need to prepare midwives in an excellent manner, that their mission is to become competent, safe beginning practitioners who are ethical, and they're leaders, and they're really leaders in their home communities, which was what Mary Breckenridge's original vision was. So that was a really lively conversation that Tonya was able to have. Further on in the week, we heard from one of our very important nurse leaders in our community, Dr. Barbara Anderson. And her theme, which she speaks on nationally and internationally, is health justice for all. So she spoke very eloquently about health justice for vulnerable populations and the role of the DNP. So we know that preliminary data is suggesting that doctorally prepared nurses and midwives moving into teaching roles with a strong clinical focus are able to make a difference. So it's really important that we are increasing authorship and scholarship and subsequently improving outcomes. So we're improving the faculty numbers. We've got stronger teaching faculty who are clinical experts, and they're able to instill in our new students the importance of leadership and health justice for all with their knowledge, with their doctorally prepared programs. Then another different voice, which was really, really eloquent, I thought, was Dr. Nina Harris. She presented the fantastic story of another wonderful nurse and midwife leader of her community, Maud Callan, who in the South was able to provide care for the poor and women of colour for over 50 to 60 years. Healthcare where Maud Callan lived was non-existent, and due to her commitment to the vulnerable populations in her area, she was able to provide excellent care. The presentation also focused on cultural competency when providing basic care to communities of colour and the vulnerable. Dr. Harris works with homeless populations, and she was able to specifically speak and in a really, really amazing manner about the importance of taking care of homeless women, being able to provide basic care, and how she makes a difference in her community. The ability that she has and her colleagues where she works to identify with these populations as people and provide comprehensive basic care was very, very moving and extremely eloquent. So I really enjoyed her presentation. I'd strongly recommend all of them, but I found this one particularly moving and interesting. And then on another similar but different point, myself, along with Dr. Trish Voss and Miss Ali Williams, made a presentation focused on inclusion of gender identity and sexual orientation in healthcare and graduate education. We know from the research that, number one, that this kind of education is lacking in many medical schools, schools of nursing and graduate nursing education, which if you're not getting the education in a topic, you're not really comfortable in taking care of populations when they present themselves for the care. We also wanted to look at how does that then affect these populations' ability to access care, because we do know that the LGBTQIA plus populations do have a reduced access to care and have increased health problems due to perhaps the lack of welcoming and inclusion in practices. And Trish spoke about how do we make our practices inclusive for all so that all feel comfortable. We really want to seek to strive for quality of care for all and inclusion in graduate teaching on healthcare for all. Further on in the week, we talked about entrepreneurship and holistic care for all families. And there's a really great discussion forum that I really strongly urge you to go over and view with our esteemed Kitty Ernst and Dr. Tonya Nicholson. Kitty really spoke about the importance of out-of-hospital birth and the science of normal birth as the midwifery model of care. We know that midwifery model of care is the gold standard for all women. So home birth midwives and birth centre midwives should really be viewed as entrepreneurs. They are offering a service that's essential for our communities, especially our underserved communities. She also discussed the midwifery model and the importance of appropriate collaboration with doctors. And we know that there's a lot of work now between ACNM, MANA, and ACOG. So it's really important to think about our professional role as leaders and working with our healthcare brothers and sisters wherever they may be. She discussed the outcomes of midwifery care and the importance of placing women at the centre of that care. Midwifery care, as she said, is the right care for women and families. Dr. Bethany Cook took that just on a different tangent and had a storytelling aspect to her presentation. She presented a first-hand account of how a nurse midwife was able to carve out a niche in her community. She was able to expand services such as transgender hormone therapy, and that was something unique that she felt she was able to offer. She, as a DNP midwife and practitioner, was able to perform a survey of needs and discovered what her services were needed. So what services, as a midwife leader in your community, what services are you uniquely able to provide to that community? So this was a really helpful presentation for all of you out there that are thinking of maybe starting your own practice or how to become an entrepreneur. DNP midwives are expanding their roles across the United States, and it was really an uplifting presentation to hear her success, especially following her DNP studies. Further from that, Dr. Erin Tenney went on to discuss Indian Health Service provision in the United States. We do know historically that IHS is grossly underfunded. However, they may have a unique model that's leading the way in terms of patient-centred and culturally safe care. IHS clinics serve Native American, Alaskan Native communities in many areas, including urban and rural settings. And services and care providers are closely tied to the communities they serve. In fact, they're often a minority populations themselves, which is so important for cultural competence to actually be embedded as a person in that community, and you really gain new understanding of that community. She also talked about white privilege, and as a white population entering IHS services, how we should be aware of any biases, or conscious or unconscious, that we may bring to bear when we are offering services for IHS patients. Community health and traditional health practices are typically incorporated into clinical care with midwives, and there really is truly a collaborative practice in IHS now. So that was a really helpful, informative session for me. I really learned a lot about the Indian Health Services there from Dr. Tenney. And finally, we had Dr. Anne Judge. She discussed how she is able to look at motivational interviewing as a tool to assist women who are overweight or obese. We do know that it's a very difficult conversation, but it's a very important conversation for us as nurse midwives and nurse practitioners. We know that nearly half of all reproductive age women are overweight or obese, and providers remain uncertain about how to address these conversations. Motivational interviewing has been shown to be an effective way to discuss behaviour change and weight loss with patients. This session was really interesting. It reviewed the current research and looked at increased awareness of societal weight bias. Lowering of BMI, we know will improve outcomes, and she looked in depth at the best way to have these conversations. So importantly, especially for the students out there, I think talking about motivational interviewing, and I know that you do discuss that in your courses, but it's a really important tool to have in your toolbox when you're talking to patients, and not just about their weight, but any other maybe addiction problems or any other difficult conversations that you have to have for your patient's health, their health, their family's health, and their baby's health. So I thought that that was a really helpful discussion on motivational interviewing. And to end the wonderful week, we had our AABC panel discussion. And this year it's in the lovely state of Alaska. And we know that Dr. Linda Cole and colleagues have produced this seminal work on birth centres. It's really the first textbook we've really had about birth centres and their role in our communities. We know that compared to the hospital-based birth model, the freestanding birth centre offers well-documented, healthier, more cost-effective, and a more humane way to care for women and newborns. The panel discussion is really fascinating. We know that we have leaders in our community right here at Frontier, such as Dr. Cole and others. Jill Alleman's another one. We can really reach out to them and find their secrets of their success for embedding birth centres in communities and improving outcomes. We know that it's a rapidly expanding model of care, and it has many positive implications for high quality, individualised care and birth outcomes across the United States. So thanks to all the illustrious colleagues at the AABC panel discussion. We all, I'm sure, really enjoyed that. So the question we posited at the front of this summary talk was, are we answering the call? Are we meeting the mission? I'd like to say the answer is yes. We are embedded in our communities. Yes, we are. We are providing the midwifery model of care. As Kiri said, the right kind of care for all women and families. We are a diverse and growing population, and we are becoming effective leaders in our community. So this really was a great week to springboard onto the future, really looking positively towards the banyan tree and everything that Mary Breckenridge provided for us with her visionary movement in the 1920s and 30s that has ended up in Frontier Nursing University and all the other universities around the United States that are providing really excellent education and training for our nurse midwives and nurse practitioners reaching into the future. We know that our family, the Frontier family, and all the other families of nurse practitioners and midwives that are under the banyan tree is strong. We are resilient, we're resourceful, we are diverse, inclusive, multifaceted, and we are ready, willing, and able to answer the call of our founding mother, Mary Breckenridge. Thank you. If you have any questions for me, I'll be happy to answer them by email. But thank you so much for taking part in our wonderful Virtual Nurse Midwifery Week 2017.